Good morning, Miss Paige. How are you doing?
Good morning.
Great. We're doing well. We're happy to have you here today. We're just going to be doing a full assessment from head to toe. Just going to be checking over everything. And if all is well, we'll get you out of here today. Shouldn't take us too long. We're just going to do a brief assessment, okay? I'm going to go gather my supplies and we'll get started. Okay, I'm going to wash my hands and I'm going to put on some gloves. Okay, first we're just going to take a peek at your head here. Any tenderness or any pain anywhere?
No.
Okay, very good. I don't feel any lumps. Okay, skin looks good. It's appropriate. There's no large lesions, cuts, or bruises. Okay, I'm just going to have you open and close right here for me. We're going to assess that temporomandibular joint. No crepitus, no popping there. Very good. Okay, I'm just going to take a peek at these sinuses here. This is the frontal and then the maxillary. Very good. Any maybe a little swollen. We have some seasonal allergies going around. Okay, and then I'm just going to have you swallow, and I'm going to have you do it one more time, and then I'm just assessing for the thyroid gland right here, and I'm able to palpate it when she swallows. That's appropriate. Okay, and then Miss Paige, I'm going to go grab my pen light over here, and we'll go over your lymph nodes. Okay. First, we're going to do the preocular. So I'm looking for all the lymph nodes here. There's 10 cervical lymph nodes. So we're going to start the preocular in front of the ears. They're movable and palpable. I'm going to go to the back. That's the post-auricular. That's behind the ears. And while we're back there on the back of the head, we'll move to the occipital. They're palpable. Any tenderness anywhere, you let me know.
Okay, thank you.
Okay. And then I'm going to go to posterior cervical on the back of the neck here. And then I'm going to go to anterior cervical in the front of the neck here. Okay, and then I'm going to go to parotid just gently below the ear. They're movable and palpable. Then we're going to go to submandibular right here. Right here. Okay. And then I'm going to go to tonsillar right behind that. Palpable, movable, no tenderness, no pain. Very good. Submental under the chin here. There's just two little tiny ones right there. Okay, and then we've already got the anterior cervical, so we'll go to the subclavicle right here, right above the clavicle. They're palpable. Subclavicular right here. Very good. Very good. Okay, let me go set that down. Okay, let me get my otoscope and ophthalmoscope. I'm going to use my otoscope and just look in your ear here. I'm going to pull the pinna up and back. I'm assessing the ear. I don't see any redness, inflammation, or fluid buildup in the ear. Very good. I'm going to go to the next ear. I'm going to pull the pinna up and back using my otoscope. Okay. Very good. I'm using my ophthalmoscope. I'm going to have you open wide. Okay, we're looking at the back of the throat. We can see the uvula. Very good. I'm just going to use the light here, and we're going to check the eyes. Here we go. I'm coming in with it. Okay. Very good. Everything is pink and moist. I don't see any patches or anything like that. Oh, the eyes are reflective to light. Very good. Okay, I'm going to get my stethoscope on and we're just going to take a listen to you this morning. I'm going to listen to the anterior, posterior, and lateral thorax. Just listening for breath sounds. Just take some deep breaths for me. Okay. Breath sounds are clear so far. We're going to listen in the posterior section. Upper and lower bases are clear. No adventitious breath sounds. Very good. Set this down. Okay, and then I'm just going to percuss. I'm just going to use my finger. We're just looking for any dullness that might come up that would be indicative of any kind of fluid or mass or anything like that. No abnormal findings there. I'm going to go to the back side. You're doing a great job, Miss Paige. Thank you. Okay, everything sounds normal there. No dullness or anything like that. Then I know we've talked about this before, but just a couple of irregular things you might see breathing-wise that we could be looking out for. The barrel chest, that's normal in patients with lung disease. With increased oxygenation, the lungs start to expand and the diaphragm starts to expand chronically. So the whole chest gets to be kind of burdened out there. Another thing is scoliosis. I'm going to have you stand up just briefly. And I'm just going to have you come right here in front of me and then just bend over and touch your toes. Very good. And scoliosis would be very good. You can stand up. Okay. An abnormal curvature of the spine, but you don't appear to have that. They usually test for that early on. You can sit down. Kyphosis, we'd be looking for an abnormal curvature of the upper spine and neck right here, where we'd be kind of hunched forward, and that can happen with, you know, arthritis and older age. So we're always trying to maintain good, stiff posture. Pectus exactivum, that's where this chest right here is almost inverted. Yeah. Inverted in, kind of an abnormal look, normally something people are born with. You can have surgery to fix. And then pectus carinatum is where it's exverted, and it's, we call it pigeon chest, you know, where the diaphragm has expanded. So we'll always be looking out for those. But as you're not a adolescent, we usually pass the screening for most of those. Okay, next I'm just going to take a listen to your heart. Okay, for S1 and S2 there. Sorry about that. Okay. Okay, and I'm going to check with my bell as well. Just looking for any kind of bruit. I don't hear a gallop or murmur. S1 and S2 are present and regular. Okay, then we're going to be listening for the arteries. I am going to one more thing. I'm going to just tell you what area where I'm on. Aortic, pulmonic. Very good. Tricuspid and mitral valve. Very good. All sound normal. Okay. And then I'm going to use the back side of my stethoscope here. And we're just going to be looking for any kind of bruits here. We'll listen for the vascular areas while we're already on it. So I'm just going to do the aorta right here in the middle. Okay. I'm going to do the iliac. I'm going to move both sides. Iliac. Very good. And then I'm going to do renal. This is where our kidneys are located. Very good. Femoral. Very good. No bruits present. No abnormal sounds. Okay, then we're just going to check your pulses. We're just looking here for perfusion to all our extremities. This is the radial. You just have to relax. I can go through the sleeves. That's okay. We'll do the brachial here. I have a +2 at radial and a +2 at brachial. Okay, and then we're going to move to popliteal. Just relax your legs here. I have a +2 pulse. I have a tibial on the front shin here. Very good, +2. And then I'm going to check the feet for a pedal. And I have a +2 bilaterally on all pulses. That's great. +2 is what we expect. So that's a normal finding. Okay, I'm just going to listen to your stomach this morning and listen for any abnormal bowel sounds. Just going to start in the right upper quadrant, moving around. Very good. Active, normoactive sounds. Very good. Okay. And then the only other thing we're going to do with that abdomen this morning is we're going to palpate for that liver border. So I'm going to start at the mid-clavicular line right here in the middle of the chest, go down to about the 3rd intercostal space. Then I'm going to move over with some deep palpation to the right, this right quadrant. And there we go. We're able to palpate that liver border by starting at the mid-clavicular line, going to the 3rd intercostal space, or we can start at that 12th rib and then move over from there with deep palpation over to the right side. Okay, next we're going to do, we're going to work on our cranial nerves here. Let me get my assessments for that. Okay, The first cranial nerve we're going to assess is the olfactory. So that's going to be talking about our smell. So I'm going to have you close your eyes and tell me what you smell.
Vanilla.
Very good. And this is a vanilla candle she's smelling. Great. Optic nerve is number 2, so sight. So I'm going to have you read this chart for me back here. I'm going to stand out of the way and have you read line 1 on this chart.
Okay. A, 7, 5, D.
Very good. And then I'm going to have you read the next line.
Okay.
This will be line 3.
Q, 3, B, 9.
Very good. Okay. Vision appears to be 20/20. She doesn't have any corrective lenses on. So that's very good. We're going to move on to the next cranial nerve. I'm going to use my pen light here. We're going to be checking the oculomotor nerve, movement of the eye and the pupils. So I'm going to use my pen light. I'm going to come into the side. The pupils are reactive to light. The red reflex is present. Okay, very good. Just turn that pen light on and take it there. About 2 centimeter. Pupils are black and round, 2 centimeters. Okay. And then I'm going to test the trochlear here. We're also going to look at eye movement. I'm going to have you follow my finger with just your eyes, okay? Very good. Okay, now we're going to check the trigeminal nerve. I'm going to have you close your eyes and tell me if it's a dull or a sharp sensation, okay?
Sharp.
Okay. And what side did we touch?
Left.
Okay, one more time.
Sharp.
Okay, very good. All right, and then we're going to do the abducens, so that's eye movement. So just move your eyes all around in a circle, almost like you're rolling your eyes.
Okay.
Very good. Squeeze them tight, and then raise them up, wide eyes. Very good. Okay, and then we're going to do the facial nerve. That's cranial nerve 7. So we're going to smile, and then we're going to frown. Very good. Okay, and then let's see. I'm going to repeat to you. I'm going to have you close your eyes and cover one ear. And then I'm going to have you repeat what I say.
Okay. 99.
Very good. Okay, then I have to do the opposite on the other side.
67.
Very good. So that tests our hearing. Or we could stand up and have you stand up and then put both arms out. We're going to close our eyes.
Okay.
We're going to test our balance here for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Very good. She was able to maintain her balance. You can sit down for me.
Okay.
Thank you. We're almost done. Okay, and then glossopharyngeal, I'm going to have you swallow. Very good. The patient's able to swallow. I could even give you a sip of this water right here, and you could take a swallow of that. Swallow is good. If I wanted to check the gag reflex, I could take a popsicle stick and depress it to the back of the patient's tongue and elicit the gag reflex there. The vagal nerve, we could test heart rate, so I'll count the radial pulse. And if I wanted to count it, I could count it for 1 full minute. So if I count it for 1 full minute, I'd count 74 as the heart rate, so we could count that. As the vagal nerve is heart rate and digestion. Let's see, and then the accessory, we're just going to move our head side to side, up and down, and all around. Very good. That's head movement. And then hypoglossal, we're going to have you stick your tongue out. Last one, stick the tongue out, side to the side, up and down. Say ah, ah. Awesome. That's very good. Okay, very good. Let me get my supplies for the next thing. You're doing a great job. We are almost done. Okay. We are going to do our deep tendon reflexes. Okay, we're going to start with the brachioradialis. Have you relax this arm right here? We'll start on this side. I'm going to tap you right here, okay? Okay, very good. Normal response. Reflex appropriate. Okay, and then I'm just going to have you kind of relax this arm. We're going to do this back tricep here. Very good. And then I'm going to come behind you on this side and do this tricep as well. Okay, very good. Let me get my other one. Okay, and then we'll do the bicep. That's next. I'm going to do right here.
Okay.
Tap. Okay. Very good.
Okay.
Okay, and then we're going to go to the patellar reflex. I'm going to have you relax those feet. No. Okay, we're gonna do the next one. Very good. And then I'm gonna do the Achilles. Okay, very good. And then I'm gonna have you stand up for me. Okay, and then we're just gonna do check in some musculoskeletal. We're gonna start with our back. We're gonna flex back and extend forward and kind of lean forward. Okay, let's go side to side. Okay, very good. Now let's do our hips. We're gonna do abduction and adduction. Very good. Bringing them out and in a circle. Great job, great job. Okay, we're gonna twist to the side. Flexion and extension here. Very good. Any pain or any tenderness?
No.
Okay, and let's do our shoulders here. We're gonna raise them in front of us. Extension. Very good. We're gonna pull them to the back. Hold them behind your. Very good. All right, and then let's abduct out to the sides. Abduct together. Any pain or tense? And then let's do some rotation there. Small circles, and let's go backwards. Very good. Okay, and then excuse me. We will do spread our fingers out. Spread. Very good. And tight fist. Okay, squeeze my hands. Okay, very good. And then we are going to take our fingers, touch each finger with your thumb, and then go back. Okay, and then let's see if there's anything else we can think of that we need to go over. I'm gonna let you take a seat, Miss Paige.
Okay.
Okay, and that will complete our exam for now. I want to thank you for your time today. If there's anything we need to get in contact with you about, everything appeared normal, but if there's anything we need to follow up with about, Dr. Smith will be in touch with you.
Thank you.
Thank you for your time today. And if there was any abnormal findings, I will report that to the physician and let them know. I'll wash my hands at the end of the exam and take off my gloves and then walk the patient out.